We hear it every year. The New York State Health Department watches influenza activity and, when they notice a spike, announces the start of flu season.
We have an immune system. We try to prepare our immune system for these events, but there's no way to eliminate sickness.
Leaving everyone wondering if and when they'll catch the sickness.
In this particular year, the biggest concern is always going to be we are going to get sick.
Most reports start in New York City, but flu activity trackers show areas of the state aren't too far behind.
Even if you have a small knit community, if you just have an outbreak, you're going to reach higher levels of that population being at a higher risk of getting flu just by the sheer fact that there's less population here.
The flu spreads easily. Dr. Nistico says the chances of getting sick or being around someone who is sick will continue to rise.
It's just natural infectious process. It's going to go up, it's going to come down. It's going to go up, it's going to come down. And that's just part of the nature of flu season. You're going to know several people who are sick at one time, and then they're going to get better.
Health experts encourage people to stay home when feeling ill, mask around others, and hand wash thoroughly. Luckily, most symptoms like sore throat, cough, and headache can be treated at home.
You want to make sure that you're managing your temperature, right? If you have a high temperature, you want to make sure that you're monitoring it and also at the same time trying to treat it.
Flu symptoms can cause a lot of discomfort, but typically don't lead to a trip to the hospital.
Having to go to the hospital requires concerns of your breathing status, potentially concerns over infection such as pneumonia, where there is a need to intervene and change course of therapy.
If you're sick, go to the walk-in, get tested, and learn you have the flu. In some cases, Dr. Nistico says prescription medication like Tamiflu can be given.
What it does is it helps reduce the virus from replicating and shedding, and you may get a shorter course of infection by taking that medication.
Well, health experts typically recommend drinking plenty of fluids, getting rest, and eating regularly. Your provider can help decide if medication or other medical treatment is needed to help you work past the flu. For Arnot Health, I'm Lexi Cutmore.